Now, these last few things that we're going to go through, these are kind of, I've had these slides. I like to keep, I originally put these ones, years ago I'd found this when I did a talk on, maybe in 2003 or something, a little bit after 9/11 and stuff. And then every time I do something on behavior management, I usually throw this in here, okay? Because this is helpful. You never know what's going to happen, whether it's a shooting in a school or a suicide in a school or things like that, you know, or a car accident that you see. There's a big car accident, lots of people get hurt. There's various counseling tips that you can do real quickly. Establish rapport, think of appropriate things to say and all that. So we're going to go through each of these real quick. How to establish rapport. Survivors respond when caregivers, they make eye contact, calm. Okay? Don't be like, are you okay? Is everything fine? Are you okay? And you just start going like that. That's going to make them even more nervous. You sit down, look them in the eyes. Hey, lower your voice. Are you okay? Is everything fine? If you start talking where you think you're going very slow, okay, their brain is going so rapid, they'll start to match you and they'll slow down with you a little bit, okay? Be very calm. Listen with their hearts. That would be you guys. Listen with your hearts. Be very sincere about what they're saying. Don't be listening to them and then be staring off to whatever else is happening at the accident too. This doesn't have to be right away. This could also be after the fact. Show concern. Okay, if you feel like if you were part of that accident, then you're not going to be able to show complete concern because you're thinking about a bunch of other things. Okay, you have to be able to go in and do that. If you're dealing with this because somebody had a death in their family and you recently had a death in your family, you're probably not the best person to be doing this because it's going to be too fresh and too emotional for you. So learn your limitations. Convey respect and be non-judgmental. Appropriate things to say. These are normal reactions. Everybody gets upset. Nobody's going to have the same reaction that you do. It's understandable that you feel this way. You're not going crazy. It wasn't your fault. Things may never be the same, but they will get better. I mean, these are all things that you can just sort of simple things that you can do, okay? What you don't want to say is it could have been worse because at that point in their life, they're not thinking it could have been worse. They're thinking this is tragic, okay? And it could be somebody says, well, only 5 people died when it could have been 10. I mean, that's not comforting to somebody in the midst of this right now. The other thing is you can always get another pet, a car, or a house, okay? Nothing will replace that pet. Nothing will replace that car necessarily, okay? They'll still remember that. So you've got to be very careful about how you say things. I had a lady who was, she was an adult, and I saw her in the ER one time, and she's like, oh, I've been suicidal with a plan and the intent for 10 years. I said, well, what kept you from doing it? She's like, my cat. And I said, okay, well, when your cat gets sick, we better start watching out. And she's like, yeah. Okay, so for her, she's like, who would take care of my cat? Nobody would treat it like I do. So that's why her sole reason for not killing herself for 10 years. Okay, so be careful what you say about that stuff. It's best if you just stay busy, because staying busy means you're not thinking about it, and if you're not thinking about it, you're not dealing with it. Okay, so you want to be able to deal with it in the way that they can, but don't just stay so busy. If they can't handle it right then let them be a little bit busy, but then they got to figure out how to reassess. I know how you feel. None of us can know how somebody else feels in that situation. You can say, I have no idea how you feel, but I can tell you how I felt when something like that happened. Does that make sense? Okay? You can say that, but you don't say, I know how you feel. And you need to get on with your life. That's like one of the really, really bad things to say. But at times like that, you also want to understand the person's developmental level too. I mean, if it's a kid versus a 12-year-old versus a teenager versus an adult. How to actively listen, allow silence. Okay? Sitting with somebody doesn't mean you have to talk. You have to enjoy that silence. You sit there with them and say, hey, I'm here. When you're ready to talk, let's talk. And you just sit there and wait and wait. Okay? They will eventually open up, but if not, they will remember that you were the person who sat there with them in their time of need. Okay? You don't have to get them to talk. Attend nonverbally, eye contact, nodding your head, carrying facial expressions, leaning forward as opposed to leaning way back in your chair. Don't have a table between you. Okay? Lean forward like you're very intent and you're listening and say, I'm here if you need anything. Okay? Some of that stuff is very helpful. Paraphrase. When they say something, take what they've said and paraphrase it and repeat it back to them. And they may say, that's not what I meant at all. Oh, well, I didn't understand because that's what I thought I heard you say. Tell me again. Okay? And so you make sure that what they're saying is what you're hearing. Okay? And you paraphrase. And by them paraphrasing, they're saying it and then they're hearing it again when you say it. That's actually part of the healing process. Expression of tense emotion, let them cry. Let them vent. Okay, that's all helpful, good stuff. I mean, that's necessary. Caregivers should stay relaxed, breathe. It's okay to feel emotions. It's okay to be angry. It's okay to be sad. All that's fine. Okay, let's kind of get it out. And then sometimes people's tones may suggest anger, sadness, or fear. Just acknowledge it.